Impact of climate change on vector-borne disease. So let's start. Understanding vector-borne disease, key climate change factors, temperatures, role in vector life cycle, participation, and vector habitat, geographic expansion, and case studies. So let's start. What are vector-borne disease? Disease transmitted to humans or animals by vectors. Vectors are living or organisms most commonly arthropods, mosquito, ticks, fleas, sandflies that transmit infectious pathogens. Examples include malaria, Zika, lymph disease, West Nile virus, changes disease, and Chagas disease. So let's start about climate change fundamentals. Rising global temperatures lead to warmer average temperature, impacting vector and pathogen development. Altered precipitation pattern, changes in rainfall frequency instantly, duration, more droughts, and more floods. Extreme weather events, heat waves, heavy rains, storms can disrupt the ecosystem and human infrastructure. Sea level rise can impact the coastal ecosystem, potentially expanding breeding grounds for certain vectors. Temperature influence on vector life cycle. Accelerated vector development. Higher temperatures speed up the mosquito life cycle, egg to adult, and pathogen replication within the vector. Increased biting rates. Warmer temperature often lead to more frequent blood meals by vector, increasing transmission opportunities. Extend transmission seasons, mild winters, and longer summers extend the period when vectors are active and disease can spread. Reduce the extending incubation period, the time it takes for a pathogen to develop and the vector to become infectious is shortened. Precipitation and vector habitat increase the rainfall, create more stagnant water pools for mosquito breeding. Drought flood cycle. Initial droughts can concentrate vectors and hosts, while subsequent heavy rains create numerous breeding sites. Flooding can wash away larvae and create new temporary breeding sites depending on duration and severity. Humidity, higher humidity, often associated with increased rainfall, can improve vector survival rates. Geographic expansion of vector-borne disease. Mold and offal spread as temperatures rise. Vectors can survive and reproduce in previously unsuitable colder regions. New population at risk disease traditionally confined to tropical or subtropical zones or appearing in temperature areas. Examples: dengue outbreak reported in Florida and Europe, West Nile virus in Canada. Impact on biodiversity. Changes in vector distribution can also affect wildlife disease ecology. Case study: dengue and Zika. Vectors, primary Aedes aegypti and the mosquitoes. Climate impact. Both species thrive in warmer, humid conditions and utilize small water collection for breeding. Expansion. Aedes mosquito are expanding their range, leading to local transmission in areas like the southern U.S., southern Europe. Increased outbreaks, climate driving factors contribute to more frequent and intense outbreaks, straining public health systems. Case study: malaria. Vector Anopheles mosquitoes, climate sensitivity, highly sensitive to temperature, for parasite development within the mosquito and rainfall for breeding sites. Highland malaria, traditionally cold or highland areas in Africa, are now experiencing malaria as temperatures rise. Changing rainfall, altered rain pattern can create new or expanded breeding habitat, leading to a localized resurgence. Conclusion and mitigation strategies. Climate change is a significant drive emergency and re-emergence globally. Adaptation, strengthening surveillance, early warning system, vector control programs, and healthcare infrastructure. Mitigation reduce greenhouse gas emission to slow global warming. Interdisciplinary approach require cooperation between climate scientists, public health officials, and policymakers.